Welcome to Evergreen Family Medicine. Today we're chatting with Michael Graham. He is a PA at Evergreen Family Medicine. Welcome back.
Yeah, thanks for having me.
So today's topic is a PCP. You hear the term passed around now and again. So let's first of all define what is a PCP.
Yeah, PCP is an abbreviation for primary care provider. Primary care provider can be anybody. Can be a PA, a nurse practitioner, DO, an MD. All of these people function together to deliver what's called primary care.
So primary care, there's another term we hear a lot about. So let's talk about what primary care is and maybe give us an idea of what the national trend is around primary care and what it looks like locally.
Yeah, so primary care is two things. One, it's the prevention of disease, so looking at preventative medicine. That can be done through screenings that primary care help deliver. It can also be done through the management of chronic conditions. So those two things that primary care does is they manage chronic conditions and they try to prevent other conditions from happening. A third thing that we kind of do that we overlaps with like urgent care and emergency medicine is that we do see acute things as well. So you hurt your back, you can come in and see a primary care. You sprain your ankle, absolutely, we can do that as well. Some things that are more emergent, maybe need to go to the emergency room or urgent care because they just have different tools. But yeah, those three things is what primary care does. Now, primary care and its delivery nationwide, there's a shortage of primary care providers. We already talked about PAs, nurse practitioners, doctors. A lot of times people go into specialties like cardiology, ortho, neurology, but not a whole lot of people choose to go into primary care. So there's a nationwide shortage of primary care providers. Locally at Evergreen, what we're trying to do to kind of buck this trend of primary care shortage is we're actually always trying to expand our practice. We've hired a lot of new doctors that have come in from residency, and we've also built our new building that's on Harvard, and we're filling up quickly with new providers. I think that there's eventual plans to also expand clinics into other areas in Douglas County, and we're going to be bringing in more providers as well. What I would say is that this allows Evergreen to deliver primary care to the community so much better. Hopefully it gets easier for people to get in to see their providers. We can address some of the healthcare shortages specific to Douglas County. And we can do this in a much more personal way with the new providers that we have as well.
We're certainly hearing all the time about people saying, I need a provider and I can't get a provider, and the struggle that comes with that. But it seems like that's being addressed right here with Evergreen. So if there was a message out to people who are looking for providers, it sounds like, is it as simple as saying, give Evergreen a call?
Yeah, I mean, really, that's that easy. Call us. One of the things that I hear specifically, and being somebody who grew up in Roseburg and in Douglas County, is that we have providers that come and they'll be here for a year and you'll get to know them and then they're gone. They're going to a bigger city, they're moving somewhere else. One thing at Evergreen that we specifically try to do is they hire people, I mean, thankfully, people like me that are from here, who love being here, who have family here, and we're here, most of us are here for the long run. You look at Dr. Tim, Dr. John, Brandon Bonds, Terry Bancroft, Scott Goebel. Some of these guys have been at Evergreen for 5 to 10. The pals have been there. They're the ones that started it. And so what I'd say, one thing at Evergreen that you're going to get that we're shooting for is not only like excellent provider quality, delivering quality primary care, but also we're looking for someone who's investing into the community, someone who's going to be here for the long run, both for you and for the community. So I would say absolutely give us a call, and we'd love to come see you for now and hopefully for years to come.
Well, thank you very much for that look into PCP. We hear the term all the time, and now we get a little bit more information behind what it actually means.
Yeah, definitely. Come down to Evergreen, and we'd love to see you.
Great. Michael Graham, a PA at Evergreen Family Medicine. You can see more about all the things that Evergreen Family Medicine brings to the community and brings to its patients at evergreenfamilymedicine.com. And you can follow Evergreen on Facebook, YouTube, Twitter, and Instagram.